Welcome back to the MediByte channel. I'm your resident healthcare professional, and today we're diving right into the medical realities and treatments behind male infertility. If you or maybe someone you know is trying to build a family and hitting some frustrating roadblocks, understanding the actual science behind reproductive health is incredibly empowering. We're going to focus squarely on the male side of the equation today, breaking down exactly how things are supposed to work, what can occasionally go wrong, and the genuinely incredible medical advancements we have to help fix it. You know, a lot of folks just assume infertility is primarily a female issue. But the crucial point here is that sperm problems account for a massive 20 to 35% of all infertility cases. It's a remarkably common medical condition, yet for whatever reason, it's just not talked about very openly. By shedding some light on this today, we can strip away that stigma and focus on the practical, clinical steps that actually lead to a successful pregnancy. All right, here is our consultation roadmap. First, we'll cover the basics of fertility. Second, what causes sperm problems? Third, diagnosing the issue. And finally, effective treatment options. Part 1. The basics of fertility. How the male reproductive system should work. To be fertile, a man basically needs a few key things to align perfectly. It's kind of like a complex biological puzzle. First up, there needs to be an adequate quantity of sperm produced, right there in the testes. Second, those sperm have to have a normal structure and shape. Third, they absolutely need vigor of movement, meaning they've got to be strong swimmers capable of making the long journey to fertilize an egg. And finally, there has to be a completely clear, unobstructed passage for those sperm to safely exit the body. If literally any one of these factors is off, fertility drops. Moving to part 2, what causes sperm problems? Discovering the roadblocks to fertility. So what actually throws a wrench in the works? Well, as you can see, there's a huge variety of factors that can mess with sperm production. Sperm are incredibly sensitive to temperature, which is exactly why the testes sit outside the body. Excessive heat from prolonged fevers or undescended testes can severely reduce sperm count and vigor for up to 3 months. Then we have hormonal imbalances and genetic conditions, like cystic fibrosis. Toss in environmental toxins like lead and phthalates, certain medications, and even physical blockages, where missing or blocked tubes literally trap the sperm inside. It's a delicate system. A super common physical issue we look for right away is something called a varicose seal. Think of this just like the varicose veins you might see on someone's leg, but located in the testes. Because these veins are enlarged, they pull warm blood. And remember what we just said about temperature? This pooling disrupts that carefully climate-controlled environment by raising the temperature, which massively reduces sperm number, movement, and drastically increases the amount of abnormally shaped sperm. Another mechanical glitch is retrograde ejaculation. This is a condition where the semen taking the sperm for a ride basically takes a wrong turn during climax. Instead of traveling out of the body like it's supposed to, it shoots backward into the bladder. The result is a total absence of sperm in the semen, a condition we call azoospermia. This can be triggered by diabetes, nervous system dysfunction, or even previous pelvic surgeries. Okay, get this. This is wild but true. You might logically think that pumping up testosterone would make a guy more fertile, right? Actually, scratch that. The exact opposite is true. Using synthetic testosterone, like anabolic steroids, totally tricks the brain into thinking the body has enough. So the body shuts down the pituitary gland hormones that naturally stimulate sperm. The result? A massive plummet in sperm production, and it can physically cause the testes to shrink. No way around it. We also have to talk about erectile dysfunction. It's obviously a major hurdle for conception because it prevents successful intercourse. But what you really should take away from this is that ED is often a massive flashing warning sign for other systemic stuff going on. It can be a massive clue pointing to blood vessel disorders like atherosclerosis, diabetes, neurological conditions, or even major psychological hurdles like severe performance anxiety. Treating the root cause here doesn't just improve fertility, it can literally save your life. Part 3. Diagnosing the issue, the clinical detective work. So, how do we actually figure out what's going wrong inside the body? We start with the gold standard screening procedure, the semen analysis. This requires a bit of time to prep. Usually, a guy is asked to abstain from ejaculating for 2 to 3 days to maximize that sperm count. The sample is collected in a sterile jar, and because counts naturally fluctuate quite a bit, the lab will almost always ask you to repeat the test with a second sample about a week later, just to be sure. They're looking at the volume, the exact count, the shape, and exactly how well those guys are swimming. Now, if that initial analysis comes back abnormal or shows 0 sperm, that's when doctors put on their detective hats. They might order hormone tests to check testosterone and follicle-stimulating hormone. They might run genetic testing to look for chromosome abnormalities or the cystic fibrosis gene. They can even do a post-ejaculation urine check to catch that retrograde ejaculation we talked about, or in some specific cases, a biopsy of the testes just to see if sperm are being produced in there at all. Which brings us to part 4, effective treatment options, modern medical solutions, and hope. Once we have a diagnosis, what's the plan? First line of defense is always treating the root cause directly. If there's a varicocele, doctors can do a minor surgery to fix those pesky veins. If we find an infection, boom, targeted antibiotics. Interestingly, doctors will sometimes prescribe a fertility medication called clomiphene. What's funny is this is usually used to induce ovulation in women, but for men, it can sometimes trick the brain into boosting sperm counts, though your mileage may definitely vary on that one. If treating the cause directly isn't quite doing the trick, we look at assisted reproductive tech. Intrauterine insemination, or IUI, is usually step 1 because it's way less invasive and a lot cheaper. The lab basically washes the semen, picks the most active swimmers, and places them directly into the uterus exactly when ovulation happens. On the flip side, we have in vitro fertilization, or IVF. This is the big one, a much more complex, highly effective lab process where eggs are retrieved and fertilized with the sperm in a culture dish before an embryo is safely implanted back into the uterus. For really severe sperm problems, like even if a man is producing barely any sperm at all, we have this absolute game changer called ICSI during the IVF process. The lab scientists literally take a single, carefully selected, healthy sperm and inject it directly into the center of a mature egg. No swimming required. It completely bypasses the need for the sperm to penetrate the egg on its own. It's a phenomenal technology that offers incredible hope. And look, if the diagnostic testing reveals that literally no sperm can be retrieved at all, it is not the end of the road. Using carefully screened frozen donor sperm is a totally viable, safe, and beautiful pathway to building your family. Sperm banks rigorously screen their donors for genetic conditions and infectious diseases, making sure the whole process is incredibly safe for the prospective parents. So, the big takeaway here? Male infertility is way more common than people think, but it is highly treatable. It's not a dead end at all. It's just a detour that requires a little medical navigation. If you have concerns, honestly, do not wait. Talk to a healthcare professional, get those baseline tests done, and find out what your options are. Thanks so much for hanging out with me for this MediByte explainer. I really hope this breakdown has empowered you with some clear, actionable knowledge today. Before you click away, ask yourself, how can you better advocate for your own or your partner's reproductive health right now? Please hit that like button, share this explainer with anyone who might find it helpful on their own journey, and definitely subscribe to the MediByte channel for more accessible medical breakdowns. Until next time, stay curious and stay healthy.